Hi, Gary. Welcome to the podcast. How are you?
Doing great. Thank you so much for having me.
Yeah, I'm excited to have you on this episode and to chat about all the great stuff you're doing there. Um, let's just dive in. Why don't you just take a moment, tell everybody a little bit about yourself?
Yes, my name is Gary Piercy. I work for the Southern Plains Tribal Health Board. We are in Oklahoma City. We are one of the tribal epidemiology centers throughout the nation. My title is an internal evaluator. I've been involved in three different programs, but here probably about the last 2, 3 months, I've been involved in a program called Thesis, which is just an undergraduate program that allows we are a virtual internship for 8 weeks. So it's been an incredible experience so far.
That's wonderful. I'm excited to hear more about that. That's when you and I first had our first conversation, was chatting about that program. You were, getting ready to kick things off. What I love to do on this podcast interviews is like ask one of my favorite questions, which takes us back a little bit to kind of revisit the path and the journey of, public health up to where you are now. And then we're absolutely going to dive more into this thesis program. But like I said, one of my favorite questions is, when did you first learn about public health or first become interested in public health as a career?
That's a very great question for me. I have been in education. I was in education for about 23 years and decided to go ahead and get a doctorate in organizational leadership. And I was in a program. They're called career techs here in Oklahoma. That it was called the BSMA, the Biosciences and Medicine Academy, and we developed a kind of an internship program. This was for high school students, and public health was kind of a branch of that. So uh, I I had kind of my tiptoe in, got my feet wet in public health, and then my education career kind of came to an end, and I graduated with my doctorate in organizational leadership, and it kind of led me to Southern Plains and led me to the aspect of evaluation. And I have been at Southern Plains now for 2 years and continue to just learn more and more about public health. Uh, Really allowing people to understand that you you can be in uh, something health wise, and it doesn't have to be a doctor or it doesn't have to be medical. It can be serving people in public health.
Yeah, absolutely. I think that this is such a broad field that overlaps so many industries, and it's always interesting to me to hear stories like yours and where people, gravitate or find their way into public health and their own connections to wherever, the other industry or whatever field. Um, Great story. I didn't even realize that background in organizational leadership. Um,
Yeah.
it's a great fit for what you do.
Serving people, I think we have parts of ourselves, and a part of myself has always been my parents really raised me to what can you do to give back to your community. And public
Yeah,
health is such a great field to be able to serve other people and to care about them and um, to give back to your community.
absolutely. I wholeheartedly agree with you on that. And we could, there's no wrong place to turn or direction to go. You really can go where your heart leads you, jump in, and there's an opportunity to serve a community that needs whatever it is that you have to offer. Um, it's a great, we're a little biased, but great field to be in, right?
Definitely.
Let's talk a little bit more about uh, your tech, what you're currently doing. And we talk a lot about the different tribal epidemiology centers when I say tech, so that for someone who's listening or for the very first time, wondering what I'm meaning by this. But let's talk a little bit more about your tell us about your specific tech that in the community that you serve, and maybe if there's a specific need or a problem that you all address there primarily.
We are probably like a lot of techs. We just are growing. Our center in the last probably 4 or 5 years has grown from 20 staff to now we have 70 staff. So it's about developing programs. I've been in 3 different programs now. One of those programs is called GWIC, Good Health and Good Health and Wellness in Indian Country. And that's the thing about texts and acronyms and all of this
Right.
kind of stuff. You got this big acronym, and I usually just say GWIC. So to remember the whole acronym
Yeah.
is kind of crazy. But for example, that's one program where we are able to kind of be a mediator between different tribal organizations and be able to help them prepare and do for their community. For
Hmm.
example, in diabetes, what about what program can we help them with in developing a diabetes awareness program? Um, like I alluded to earlier, a program, the most recent program I've been involved in, and because of my education background, I'm very excited about it. I love it. It's called Thesis, and that is Tribal Health Experiential Student Internship Seminar. This is what we're doing is you talk about public health, and as you said, it is just so robust and so big. Uh, so many students begin and they major in biology or they major in something science, and they're drawn to that, and they might not really understand what public health is about. And this is a program for undergraduate students in college who we have 50 interns, and it's an 8-week virtual program that kind of addresses 3 different things. We have example-based learning, where from Monday through Thursday, from Central Time, 9 a.m. to 1 p.m., they kind of learn classes like Intro to Epidemiology, Intro to Public Health, just kind of the broad understanding of what public health is. And then we also want to develop those soft skills. We want to develop leadership skills, professional development. How are you doing on your resume? Some of these students, they're starting to graduate from undergraduate. So are you going to get a master's in public health? What's your plan? And then also really kind of what's your plan B? What if something doesn't work out? So developing their resume, working on that. And then the culmination is they choose a research project and put together a poster presentation where they will present that in Atlanta, Georgia, at what's called the CDC Showcase.
Wow. I'll bet that's exciting for them, uh, to know that
Yeah.
they're gonna be able to present at CDC. That's pretty cool.
Yeah, this is our first year. This program, which is it's called the Scholars Program. Excuse me.
Mhm.
It's funded by the Office of Minority Health and Health Equity of the CDC. It's actually been around for about 10 years, but this is our first year receiving this grant and being in this grant. So it's been a whirlwind. We received the grant last September, um, October, and then to put all of the pieces together, we started in uh, late May. So to put all those pieces together, it has
Wow.
been lots of work, but it's
Yes.
been so rewarding because you see these uh, 50, 50 interns, kind of the light bulb go off. And it's kind of like, wow, that makes sense. I love it. I love the pieces coming together.
I cannot tell you how many times I've interviewed guests on this podcast who, learned about public health. They started down the medical school route, myself included, really interested in something health focused and serving people. And through the course of multiple other, career twists and pivots, you know, end up here in public health. And it feels like, oh, this is really what I wanted all along. So when you know, dating myself here, but way back then we didn't have undergraduate public health programs. Um, I didn't understand what public health was until I got to grad school. So to know that this internship program exists is, I can imagine the light bulb moments for these students, and I think it's wonderful. I would love to see and hear about more of this happening, around the country. But uh, I I'm excited for the students involved, the interns involved, and for you all being a part of seeing that, witnessing that and kind of helping to turn that light on, so to speak. Um, I want to step back just a little bit to make sure I understand. How did the thesis program, like, who created that? Where did that start?
It started with the CDC, um, and with their Office of Minority. So again, it's about a 10-year-old program. So it's an application process through the grant, the CDC grant process. So our organization uh, is always looking for different ways that we can create a program or create something. And this is something that me and my coworkers really we're very interested in, passionate about. And
Mhm.
that to me is what our organization really pushes.
Yeah.
Find something you are passionate about, and then let's work to make the best program we can. And that's the beauty of where I work and what I'm a part of. Uh, they're always wanting you to be that leader,
Yeah.
take take charge and find out, hey, what's a program that you can sink your teeth into, really create an excellent program, and how can we support you in getting there?
Yeah. I love that about your organization as well. That's how we win in so many different ways. So these interns, um, are they um, are they coming from um, all different backgrounds? Is there how are they selected?
We had a selection process, and in our first year we actually it really turned out well. We had about 100 applicants for 50 spots. So I think for a first year program, that's pretty good. We tried to use all of social media to publicize. And one of the beautiful things about our program, uh, for it being because it is virtual, we are allowed to open it up to the whole nation. So we have interns from Alaska, from Hawaii, from California, from the East Coast. So it was through an application process. They had to do a personal statement, kind of send in their resume, tell us kind of what they why they were interested in public health, and then we narrowed it down to 50 applicants, and kind of started the process of what would you like to research? What is an interest? One of the big components is every Friday, Monday through Thursday is kind of the learning type of process, kind of with school type of stuff. And then Friday, they meet with a mentor. And that mentor kind of guides them through and helps them with their research project. Um, so
Mm,
that has been a great, great experience. We have mentors from tribal communities. We have mentors from the CDC. We have just a whole array of different experience that students can learn from people in the field. So
yeah.
that's been I think, a great experience both for the interns and the mentors, because the mentors really are getting to see um, kind of a caliber of person out there.
Yeah. I love that as well. I've actually talked to one person that I know who's a mentor in the program, and she really enjoys being able to work with the intern. And so that's already great, feedback so early on. I know that from what I know from hearing and speaking with people over the years, mentorship has always been something that people say is missing. They wish they had. Um, and so I'm happy to hear that that's an important, that's a component of this program. I also like that that they're also getting exposure to the Tribal Epidemiology Center, specifically the work that you all are doing in Oklahoma, and then they're being exposed to what is being, the work that's being done around the country and in the other techs as well. I'm sure that's a part of the light bulb experience, but are you starting to get any kind of early feedback from the participants about, um, you know, the mentorship, the tribal epidemiology work, anything like that?
Yeah, I think it's a component that has to continue to be communicated, and people going, "Oh, I didn't know about this. Tell me more." We had a kind of a seminar over racial misclassification, and
Mm,
students are just so fascinated by that topic. And there are many topics like that that undergraduate students aren't exposed to. So the more we can expose them to different topics that might spur them on in public health, but in a little bit of a different direction, um, I think we're doing our job. And I think the future years, this is a 5-year grant,
mhm,
which could even extend longer. We're doing our job. And
mhm.
I can't wait to see, a couple of years down the road, where are the interns going, kind of what types of jobs, and how we can continue to improve and make better.
Yeah, that's a great thought because I'd be curious to hear, 5 years into the future, what these interns are saying, like, what part of this program are they still, feeding off of, years to come, and I'm sure it will have that type of an impact.
Yeah, and there's so many different facets. evaluation. How do we make programs better? How do we go into Native communities and gain trust? How do we develop a rapport?
Mm.
So within this first year, we have about 60% of our interns who are Native American. So it's been a very interesting response to see their perspective, the way they have grown up, the way they bring their background and their learning um, into education, and how they can make better, how they can use their experience to move forward in public health.
Yeah, that's wonderful. I didn't know that the percentage was that high. That is really, really great. Great to hear.
Some of our what I've also been so impressed with are some of the projects that students are doing and that they're involved in. This poster presentation, we've got the incidence of breast cancer in Native Americans. We have opioid use, and we have food sovereignty. We have inequity in healthcare. We have diabetes, and cholesterol level, and so many different topics that's that's just going to bring more and more awareness to Native communities, and bring exposure. And that's what we need. We need more exposure. We need more research, and we need people to uh, see these projects to be able to just have more understanding, more knowledge. One of
I
the other components that I have loved is uh, another deliverable that these interns have to do is they have to create a digital story over their topic and how it kind of relates to their life, why they are interested. So you've got the scientific poster, which is more kind of research, but then you have a component that brings it home. Why is it important to you? How has it affected you? And that's where you get kind of an emotional pull uh, to why this is so important.
Oh, that makes such I love that part. I love that's what I think of, that creativity in public health. We need to be able to tell our stories, and the stories need to be personal and engaging and help bring life to the data and all the other scientific elements. Um, is will this be available beyond outside of the CDC showcase? Will this be available, for someone like me to view?
Yes, yes. On our website, we will put all of the poster projects and their presentations, and then also the digital storytelling
Oh,
uh,
this is exciting.
component.
So what I'm going to make sure that we do, a little later, I'll share with everyone how to find the show notes page for this episode. But and at the time of our conversation, it's midsummer, and the you've got a few more weeks to finish, and then before we get to that point. But a few months down the road, they've done their presentations and you have it up on the website and the link is available, make sure that we know so that we can update the show notes page. So someone who's listening to this, months later can then go to the show notes page and be able to, they'll hear our conversation. They can also then see the presentations.
Definitely. We will
Yeah.
definitely do that.
I remember working with I do a lot of work with the different techs, and I mentored an epidemiologist who's very passionate about food sovereignty, and she had her regular work, projects that she was assigned, and then they were also allowed to pick passion projects that they could work on in their extra time, and that was one that she was working on a paper about food sovereignty and some of the challenges. And because I was, really overseeing that team and mentoring her quite a bit, I became really engaged in that topic. So I found myself following on Instagram. I'm following this um, native restaurant in Southern California, and it was all about food sovereignty. They was educating the public about the native foods, and so I really got really pulled into that topic. So when you mentioned that was one of the topics of the interns, I thought, "Ooh, I'd love to see that one."
Yeah, and isn't it it's just what's so great is that each one of these, they kind of just have this little passion in their heart,
Mm.
and that's what they can present on. You know,
Yeah,
when you're passionate about something, it's incredible what people can produce.
yeah. I love this program. I love the way that you all are delivering this program. I'm very excited to see how this first cohort, wraps up, and your takeaways and plans for continuing. I'm glad that it's a long term. So next year will be a whole new cohort of interns, right?
Correct.
Okay,
Yes.
nice.
And I
Very
think I said, but this culmination, the experience is so great, but the culmination is getting to go to Atlanta, presenting their findings, kind of uh, to me, if there's one thing I want people to know, it is you can be led somewhere, but in the end, you're the one who presents yourself.
Mhm.
Your professionalism, those leadership skills that you develop, how you represent yourself, hopefully will take you to the next step in life,
Yeah.
your next internship or your next job. And if that's something I really pound into these interns, it is take every opportunity you're given. And although the opportunity might not lead you uh, to whatever you want, it can at least give you information, knowledge, and an experience to take you to your next road.
Yeah, absolutely. I also, as you were explaining that, I realized, you know, this is an important, like, so many layers to this that I really like. But one thing I really want to point out is sort of the hybrid nature of this delivery. Not only are they able to engage virtually, which makes this possible for people that don't live in Oklahoma, that could not commute every day to your office, for example. But then there's that component where they have the opportunity to be face to face and be in person and engage and interact. And that will I've delivered these types of events where we have a virtual part of this where it helps us to connect, to get to know each other, and then once we're in person, it's such a different experience. It's not the first time you're meeting; it's just you're escalated so much further along, and it makes for such a magical experience. So I think that uh, this will be something that will stick with people for a very long time. Relationships will be further solidified because of the folks that they've engaged with. And I'm sure they're not all 50 engaging and getting to know each other virtually, but when they're in person, there's that opportunity to connect with people that you'll find things in common that you wouldn't have picked up in the virtual setting, but then they can continue those relationships throughout their undergraduate journey and beyond. So there's a lot of power in this a hybrid, sort of framework here that I think is worth noting and pointing out. It was exciting to see how if you're tracking that over the years, how those relationships continue to develop, and maybe even those people coming back and engaging with a future cohort. It's just there's a lot of possibilities there.
Absolutely. That's what's so exciting about it. And I love the excitement from the internships. We've got a couple of weeks before we go to Atlanta, and the excitement is building, and you can hear in their voices the joy of getting to meet each other and have that one-on-one personal experience with each other. So
Yeah.
that's a very exciting thing.
Oh, I'm really thrilled for everyone involved. All right, so I am personally very invested in seeing this through and supporting because I really believe in this in the way that you all are delivering this program so wholeheartedly. If someone's listening now and he's thinking, "Oh, I would love to know more about that," either for themselves or so they can share it, um, we're going to have a lot of links in the show notes. But if they're listening now and are ready to write something down, how what's the best place for them to go to learn more about this program?
We do. We have a website. It's thesis.spthb.org. Let me repeat that. Thesis, THESIS dot spthb.org. And all of the information is on our website, and the contact, you can reach out to our team if you have specific questions. And this year one has been incredible, but I just can't wait till year two because we've learned so much. And I think from year to year, you just get better and better.
Yeah, absolutely. Well, I'll make sure that, this information, the links are in the show notes page so that, like I said, anyone who people may be exercising while they're listening to us, driving, doing other activities, but I want people to easily be able to come find everything in one spot. So we'll connect to the show notes in just a moment. I would like to wrap up because we have had such a rich conversation and I've really enjoyed it. Before we completely wrap up, I do have just one more question for anyone who's listening and thinking about, this program, maybe applying for themselves. Do you have any bit of advice for someone who may be interested in, maybe thinking about submitting an application for a future year?
Um, I, to me, the advice is always take every learning opportunity and take something from it. If you apply to this and you are able to intern here and you go, okay, I've learned X, Y, and Z. Now this can take me to my next phase in life. To me, life is about a continual learning, continual being the best you can be. Maybe you have in your framework, hey, I'm going to be a doctor, and things happen, and I always have a plan B, I guess, is my true advice to everybody, and to
Yeah.
always learn everything you can.
Well, thank you for that, Gary. I appreciate it, and our listeners appreciate it as well. Also, thank you for taking some time and meeting with me to chat about this amazing program and the work that you're doing. I know we'll be in touch for sure, but I just wanted to say thank you for being on this episode.
And thank you so much. I appreciate it.